Welcome back to the Hot Flash Diaries podcast. This is episode number 10, and I'm your host, Jessica Caceres. Today's episode is dedicated to that of genitourinary syndrome of menopause. It is a topic that is near and dear to my heart, as I see a lot of women in my practice, both in family medicine as well as in my practice focused on women's health. And we talk a lot about discomforts related to vaginal dryness, painful intimacy, and lots of discomforts just around what low hormones does to a woman's body as she gets older. And it's a topic every day when I see a patient in family practice who has come in with, multiple urinary tract infections, and we have a conversation around, hormone health, I am shocked to hear that nobody has ever talked to them about how hormones, in particular estrogen, really does impact that of the development of urinary tract infection in women, especially menopausally and postmenopausally. So this syndrome is really what it boils down to is, and I hate calling it a syndrome because it makes it seem like, it's something that is wrong or shouldn't happen or is a cause of, something awful. It's a cause of truly low hormone levels, specifically that of estrogen and testosterone. So this hormonal deprivation state of, again, estrogen and testosterone in perimenopause, menopause, and then later on in postmenopause result in vaginal dryness, which can lead to things like pain with intimacy, decreased lubrication, a lot of irritation externally and internally for women. But it's not just about the vagina. It's also about the urethra, the bladder, the vulva, the vulvar vestibule. Our entire pelvic region is hugely dependent on hormone levels and very sensitive to hormone levels. So of course, as those hormones begin to decline, that's when we start to see changes in the tissues, which can cause all of these symptoms. And what I see in family practice that I find most frustrating is women who've come in who are postmenopausal, who end up having multiple urinary tract infections back to back. Perhaps they've had a urine tested and it's come back inconclusive, or that they haven't had a urinary tract infection or didn't have an infection, but they were put on antibiotics because they were symptomatic of a urinary tract infection. So symptoms like frequency with urination, burning with urination, maybe their urine smelled a little off. And the family doc just thinks, okay, maybe it's a urinary tract infection. Let's test you. Let's give you an antibiotic, and sends them on their way. But they never really feel quite right. Or there's women who have back to back to back documented urinary tract infections who really could have had a prevention of these urinary tract infections had we have treated their vaginal health. And so you may wonder, well, what do UTIs have to do with hormone deprivation or hormone levels that decline as we get older? And it's actually quite fascinating. So what happens is that our estrogen and testosterone, but mostly estrogen in the vaginal wall, actually produces glycogen. So the estrogen keeps the vaginal walls healthy by keeping them plump, and the vaginal wall therefore produces glycogen. So glycogen is essentially food for bacteria, but not just any bacteria, the good bacteria. Most people have heard of the term the microbiome or the microbiota. It's basically all of the bacteria that covers our entire body from head to toe. Our vagina is no different. We have tons of good bacteria that are in our vagina and around our vulva, our vulvar vestibule, the urethra, all of these areas in our genitals that have this good bacteria. And what happens is, as the hormones start to decline, the walls of the vagina, the walls of the vulva, all of this very susceptible tissue that is super susceptible to hormone levels begins to reduce the production of glycogen. And so what happens is that bacteria starts to slowly but surely die. In addition to the tissues change in the vagina, they become a lot thinner. There is vaginal rugae, which is essentially the sort of wrinkly tissue that's in the vagina that begins to sort of become smooth and thinner, and it becomes really like tissue paper, the whole vaginal area. Sometimes the tissue retracts to the point where you can even see the urethra, or that is the tube that we urinate out of. So for those people who are not familiar with what a urethra is, all of these things become more visible. We start to see things like the labia minora start to sort of disappear. So if you look at a woman's vulvar region when they are older in comparison to when they're younger, there are visible changes, and that's because of the decline in hormones. And so what happens is, as these tissues become thinner and we start to have these changes and our microbiome changes, we are more susceptible to developing urinary tract infections. So that is what we see in postmenopausal women in particular, where they start to have these back to back to back to back urinary tract infections, and then we treat them with antibiotics. So in addition to their microbiome already being off and their vaginal flora being completely off, then we're introducing more antibiotics into their system, which they really don't need because it's not an actual infection in some cases. In some cases, it does require antibiotics. But in the end, we end up adding insult to injury. And what's cool about all of this is that it is a treatable condition. There are so many options available that are Health Canada approved, such as Premarin cream. There's an E-string, which is just quite literally a little ring that you put right into the vagina that emits or releases estradiol. There is Imvexy or Vagifem, which is a little capsule that can be put into the vagina. There's a priming period, and then there's a maintenance phase. And there's also Intrarosa, which is a newer medication. It's actually DHEA. And so this is an androgen, right? DHEA is a precursor to testosterone. And we know that when it's applied intravaginally, it can help to do all the things that estrogen can also do, which is plump the tissues back up, which helps with bringing blood flow back to the area, which helps to heal and to soothe as well. So if we're able to get the tissues innervated again with hormones, so whether it's estrogen, and in my practice, I typically like to start with estrogen first, and then we can add in or replace with DHEA or the Intrarosa if the estrogen itself has not been effective for specifically this GSM or genitourinary syndrome of menopause. What is amazing about these products is that there is no systemic absorption, meaning that what you're utilizing in or putting into the vagina doesn't actually get into the bloodstream and affect full body. So in some cases, in women who I'm treating with topical estrogen and oral progesterone, if they're not getting relief at all or not enough relief of their vaginal dryness, etc., I will put them on a Vagifem or a Premarin intravaginal to treat those symptoms, and it works great. So just because you're on hormone replacement therapy via topical or oral, it doesn't mean that you cannot have the vaginal treatment as well. It is very common to be on both, depending, of course, on what the symptoms are. There are, of course, women who go through their entire perimenopause, menopause, and postmenopausal stages and never experience vaginal dryness or a urinary tract infection. But that is not typically the norm. Most women have some sort of vaginal discomfort, and we know that the oral or topical medications do not quite cut it for most women. So that is one area that there's a lot of misconceptions in terms of whether or not you can be on dual therapy, and you absolutely can. And what's really cool about this is that women who are breast cancer survivors can in fact utilize this vaginal estrogen safely. Of course, everyone needs to talk to their family doctors, nurse practitioners, or their specialist for individual advice. But these treatments can be highly effective and can really help with that dryness and discomfort and improve quality of life. Again, what's interesting with this low decline or this declining estrogen state is that there are other conditions or other times in our lives when this can happen. It's not just related to perimenopause, menopause, and postmenopausal conditions or states. This can actually happen in postpartum, in this postpartum stages when our prolactin levels are high, which cause the estrogen to be low while we're breastfeeding, for example. And there can be a lot of vaginal discomfort, a lot of pain with intimacy. That can be rectified with that of vaginal estrogen. Likewise, women who are on oral contraceptive pills when they're younger, or even women in perimenopause who choose to go with an oral contraceptive because of the concern around pregnancy, that does cause a lower estrogen state in some cases, which can cause more vaginal discomfort. So we can treat that effectively with vaginal estrogen or the Interosa, which is the vaginal DHEA, the precursor to testosterone. And of course, by treating the tissue and getting it back to its healthy state, where it's producing that glycogen and it's feeding the good bacteria, that in and of itself will help to prevent UTIs or urinary tract infections by improving symptoms like, painful urination, frequent urination, and that urgency. But in addition to that, it improves the vaginal dryness by increasing lubrication, which can make that pain with intimacy feel so much better. And even just the sensation, like nobody wants to feel a dry vagina when you're walking around doing your thing and living your life. Nobody wants to have that feeling. It's a terrible sensation. And if we can improve that and improve our quality of life, why wouldn't we? We're really fortunate here in Canada to have so many different options of vaginal estrogen that's readily available. It's rare that it's not available or back ordered. So we have that option. It's just really about going in and chatting with your family doctor, your family nurse practitioner, or your specialist to say, look, these are the symptoms that I'm having. Is vaginal estrogen or Interosa, which is vaginal DHEA, right for me? It's really important to have those conversations and to understand that there are treatments available to help you feel better. It's also important to understand that you do need to be on these medications for about 2 to 3 months before you get that maximal benefit. But it is something that you need to stay on long term. Every medication has a different regimen. So for example, the Vagifem inserts, you need to do a priming period of using it nightly for about 2 weeks, sometimes 3. And then it's reduced down to 2 to 3 times a week, depending on how significant the symptoms are. Interosa is something that you need to use nightly. The vaginal ring is something that gets changed about every 3 months. So it really is dependent on, your needs and what your symptoms are and how severe they are as far as which treatment is appropriate for you. But there are so many different options available. The last thing I want to mention about these products, and probably the most frustrating part of the products or these particular medications, is that if you were to open up a box of Premarin, which is vaginal cream, or your E-string or whatever it is, there is a black box warning on these medications that date back to the warnings that we talked about in episode 1, 2, and 3 of this podcast, where we really demystified a lot of the concerns around hormone replacement therapy. So even though this is vaginal, it's topical, and we know that a lot of the concerns around estrogen and causing strokes and heart attacks and breast cancer have really been debunked. The manufacturer of these products and Health Canada insist on posting or printing this warning on the box. My recommendation is, if you are concerned about that warning, have a conversation with an educated provider who really understands hormones so that they can explain to you the pros and the cons of the treatment. Don't take the black box warning as, entire truth, because it unfortunately, has really deterred a lot of women from utilizing these products and feeling the best that they can, because they read the insert. I think if you were to read the insert of a Tylenol tablet or an ibuprofen, for example, you would never take anything ever. It's all about looking at the pros and the cons and understanding that the concerns that were printed on all estrogen products, including these vaginal estrogen products that are topically absorbed and do not have systemic absorption, meaning your body does not absorb them, is all based on the Women's Health Initiative study, which has been debunked over and over and over again. So vaginal health is super important. It's important for quality of life. It's important to have a wholesome, intimate, life and partnership with your significant other, with yourself, and to be able to enjoy that. And it's most important to help prevent urinary tract infections because they do cause a lot of overall health concerns in terms of, that reduction in flora by being on antibiotics continuously, as well as we get older, the risk of developing what's called delirium should we get an infection is quite high. One of the things that long-term care physicians and nurse practitioners are constantly on the lookout for when they start seeing some confusion in the elderly is related to a urinary tract infection. It's sort of a first presenting sign for patients that would otherwise not have symptoms like burning, urgency with urination, etc. So the last thing we want is for women who are post menopausal, who start to develop these urinary tract infection symptoms. They become delirious, they fall, they break their hip, and then their mortality rate is quite high. It sounds sort of alarmist to say that urinary tract infections can kill, but they do. It's really about being educated to understand that there are so many treatments available to prevent getting to that point where we're getting recurrent urinary tract infections and, being on antibiotics long term. So really a quick, short episode, but a very passionate one for myself after, seeing so many women, so many elderly women who have never been, chatted with about topical estrogen, vaginal estrogen, and the benefits of replacing that declining estrogen to improve their vaginal health and prevent urinary tract infection symptoms and recurrence. I see it almost every day, and it really is something that we can improve. So I look forward to, spreading the word and getting as many people, educated on this topic as possible, because really it is all about prevention and really living a wonderful, long-term life without having to worry about being on antibiotics and about harming our microbiome. So that's really what it's all about. Thank you for listening. I really appreciate all of your support with this podcast. It's been absolutely fabulous. And our next episode, we are fortunate to have Dr. Fallis back, where we chat all about men's health. We'll talk about testosterone and how men's health changes or differs from that of women's health as far as signs and symptoms of declining testosterone level and as men head into sort of that phase of their life. So thank you so much. I wish you all a fabulous day.